Right, we'll make a start then. So thank you so much for watching. We're here, Ovarian Cancer Action. We're talking about prostate cancer with our special guest, Orchid, fighting male cancer. My name is Jo, and I'm the Cancer Prevention Officer at Ovarian Cancer Action. So I look after raising awareness of all things hereditary cancer, genetic testing, and so on. This webinar is one of a series of workshops and webinars that we've got going on throughout Hereditary Cancer Awareness Week. We've got lots more sessions still coming up this week, so please do take a look at the programme on our website and our ongoing. We've recently also set up a monthly newsletter specifically for people with high genetic risk. That's got lots of updates in terms of latest research and guidelines and so on. So if that's something you're interested in, please do sign up if you want to keep up to date with that. A little bit of information about how the session will work. Today's webinar, you should be able to see myself and our guest expert. We're recording this session so that people can watch it again later. If there's any questions from anybody, please feel free to use the Q&A function at the bottom of the screen, and we'll try and answer those as best we can. To introduce our guest expert today, we've got Rob Corns, who is the Orchid Male Cancer Information Nurse and is here to talk all things prostate cancer with us. So thank you very much for being here today. I'm just going to start off by covering a little bit about BRCA and prostate cancer, and just a really quick run through, because I want to make sure that Rob gets plenty of time to speak about prostate cancer signs and symptoms, so on. So you can always take a look at our website, ovarian.org.uk, for more information about prostate cancer, about genetic testing rather. So I'm going to share my screen with you now so that I can show you a few slides. But really, I'm going to just talk through a couple of things really quickly. One thing I really wanted to highlight today, when people think about hereditary cancer, often it's the women that come up and it's the female cancers. Ovarian Cancer Action, we're really keen to talk about ovarian cancer. Most of the time when people think about hereditary cancer, they think about female breast cancer. And one of the main messages that we want to make sure people know is that those aren't the only cancers to look out for in your family tree. So please, if you are looking into whether you have anything to worry about in your family tree, please make sure that you look out for all sorts of different cancers. I mean, there's always lists of cancers, but really I always say to people, just write down everything you can find in your family tree that might be along these lines, because all of those things there, if you have multiple cases of these cancers in your family, it might well be a red flag. Those ones along the left are generally linked to BRCA1 and BRCA2, and those on the right are linked to something called Lynch syndrome, which is a group of faulty genes that also increase the risk of cancer. Something that comes up quite often is the idea that, again, not only that it's women's cancers, but that it's only females that can pass on these faulty genes. And it's really important that people know that a man is just as likely to carry a faulty BRCA gene as a woman is. And these genetic mutations can come down the female and the male line of your family, and we can pass them on to our sons as well as our daughters. So if you have a BRCA mutation and you have children, it's 50-50 chance that you're going to pass it down to each one of your children. Really quickly then, to run through some of the lifetime risks for male cancers in relation to BRCA in particular. Something that not many people are aware of is that there is that increased chance of breast cancer there for men, which people think men can't even get breast cancer, and they can. And actually the survival rates are a lot lower than women because men think it's not something to worry about. And if you see there, the figures for BRCA2 are particularly the ones that we're interested in with relation to male cancers and that increased risk there. For BRCA2, that increased risk of prostate cancer, I should say all these figures, there's so many different studies, and different studies always have different figures and different bands. So these are kind of rough numbers. There'll always be research that finds things slightly higher or slightly lower, but kind of rough numbers. And it's BRCA2 that we're particularly looking at in terms of prostate cancer. For BRCA1, there's research still ongoing, as I say. There are some studies that think there's a slight increased risk and others that think it's probably just similar to the normal population. I'm a really visual person, so I like to put these into pictures. So kind of to visualise there what that risk there is. If you see the difference in risk from the general population to compared to BRCA2, as you can see, the BRCA2 out of 10 men with a BRCA2 mutation, you're looking at 4 of them getting prostate cancer in their lifetime. And Lynch syndrome, is one that is still being looked into in terms of research. Again, there's some research that suggests there's a slight increased chance for the genetic mutations that come under Lynch syndrome, and others not so much. So we've got to keep our eye out really to find out whether that link, how strong that link is, and what that lifetime risk really is. And it's worth saying as well that when, in terms of hereditary prostate cancer, you're looking at kind of cancers being diagnosed at a slightly earlier age as well than the general population. The question that always comes up is who's eligible for genetic testing. I really want to point out to people, if they're watching and they're worrying about their family history, please don't panic if you do have any family history of cancer. Most cancer isn't hereditary. Okay, so most cancer is bad luck, a combination of different genes and environment and so on. And you're only looking at about between 5 and 10% of all cancers are linked to something like a BRCA mutation or something similar. That's why if you just have one family member with cancer, that doesn't automatically mean you're at high risk and need to get a genetic test. If you have personal diagnoses of cancer, so ovarian cancer, the most common types of ovarian cancer, if you have a diagnosis at any age, you should be eligible for genetic testing. Same with colorectal cancer, any age, and breast cancers at an early age as well. But really, in terms of the red flags to look out for in your family history, just think about it in terms of if you have multiple cases of those cancers that we mentioned at the beginning. If you have individuals with multiple cancers themselves, so if someone's had 2 cases of cancer themselves, younger diagnosis does imply a higher risk of carrying a genetic mutation. Male breast cancer is a really, really big red flag. And also it's really worth pointing out that certain heritage increases the risk as well. So Ashkenazi Jewish is the big one there. The general population has 1 in 400 chance of carrying a BRCA mutation. And for Ashkenazi Jews, it's 1 in 40. That's 10 times the average population. And of course, as I've already mentioned, please look at your father's side of your family as well, not only your mum's side. If you want to explore this a little bit more, you can go to our website, ovarian.org.uk and /risk tool. And that's a really simple tool that you can use to kind of put in your family history, any case of cancer that you've got in your family, and it gives you a really simple view as to whether you might be eligible for a referral for genetic testing. So I wanted to quickly run through that before I hand over to Rob. I know, Rob, you've got all sorts of information that you can share with us about prostate cancer today. That would be brilliant.
Yeah, I mean, I can give an overview of prostate cancer, some of the risk factors and the symptoms, and what to do if men are worried. So I'm just going to share my screen as well. Okay, so in the UK today, we see about 49,000 men being diagnosed with prostate cancer. So that actually makes it the most common cancer in men, but also the most common cancer in the UK. And the general risk to the male population tends to be suggested as 1 in 8. Now, there is some research to suggest that if you're born in the 60s, in 1960, then your risk may be about 1 in 6, but that's not really sort of widely discussed. The good news is that it's a very treatable cancer and potentially curable, and about 80% of men who will be alive 10 years after their diagnosis. So the main risk factor for prostate cancer itself is really age. The longer you live as a man, the greater risk you have. And we would generally accept that the majority of men in their 80s will have some evidence of prostate cancer if we look for it. At the moment, the general average age is around 60, 65, and it's rare to see it below the age of 50. However, I have seen men in their 30s and 40s, and as a direct link with the BRCA gene. There are some other links or risk factors that we see. One is basically family history. And if your father was diagnosed with prostate cancer around about the age of 70, your risk is a couple of times greater as a son. That stays the same for brothers, about the same sort of risk. But the risk does increase a lot more if that person, your brother or father, developed prostate cancer at the age of 60 or below. Now, there are some genetics involved which we haven't quite got to the bottom of, and there is a very strong link, as you've said, with the BRCA1 and BRCA2 gene. And as again you said, typically men with this gene will usually present maybe 5 to 7 years earlier than the normal sort of onset. And I have certainly met a chap at 37 whose father was diagnosed at 60 with the BRCA gene, and a very young lad at 40 who had 5 sisters who were all diagnosed with breast cancer. And as a result, he had to have quite intensive treatment at a very early age. So, you know, there is that risk there. We also know that ethnicity increases the risk. Black men or men of direct African Caribbean descent are twice as likely to develop prostate cancer than Caucasian men. We don't really know why. There's been a huge amount of research over the years, but the risk is increased more, and these men tend to present at a slightly earlier age with potentially more difficult prostate cancer to treat. So if we sort of come to the symptoms, then there's a few myths around this. Now, blood in the urine can be a symptom of prostate cancer, but it can be a symptom of urine infection, kidney stones, other cancers of the urinary tract. You can get blood in the semen, which can be quite worrying, but this can just happen sometimes without any obvious cause or maybe infection. You can get difficulty in passing urine, but the majority of men with early prostate cancer will not have any obvious urinary symptoms. And that's because the cancer starts in an area of the prostate which doesn't directly involve the urethra or water pipe or uterine. So relying on the urinary symptoms is not a very good way of making sure you haven't got prostate cancer. And in fact, problems peeing are more common in men who've just got an enlarged prostate or a problem with their bladder than prostate cancer. So it does make it a little bit difficult when you come to try and identify men with prostate cancer. The only thing that's available at the moment that's been tried and tested and does help to some degree is something called the PSA blood test. And this is just PSA is a substance made by the prostate, and as you get older and the prostate gets more active and bigger, it leaks into the blood. And as you get older, you can assign a certain value of what should be there. So at a certain age, you can have a blood test, and if it's a little bit high, it could indicate that there may be a problem. The trouble with it is that it's not that specific. And in fact, if we look at it in more detail, we know that it's probably about 50–60% accurate on its own. And the reason for that is that other things can influence the activity. So if you have an infection in your prostate, if you have an infection in your urine, if you exercise vigorously, if you have sexual intercourse or ejaculate, it increases the value. So it's not specific. And we know that about 5 or 10% of men with prostate cancer will have a normal PSA level for their age. So it's not the best of tests. And the other thing is that even if it leads to a diagnosis of prostate cancer, it doesn't necessarily mean that that cancer is ever going to cause a problem. But, you know, if you've got a cancer, you'll want something done about it. And the treatment for early prostate cancer can often outweigh some of the side effects. I mean, the cancer itself. One thing we do tend to recommend if you are being investigated or worried is that somebody, a GP or healthcare professional, perform a digital rectal examination. So basically, that is an examination of your prostate by putting their finger up your backside, unfortunately, which a lot of men shy away of. But because the prostate is fairly accessible, if there were cancer on the surface of the prostate or it didn't feel right, it could be an indication that there was a problem. So it's quite important that you know, it's an investigation done, very easy investigation done, as well as a PSA blood test. Now at the moment, any man over the age of 50 is entitled to go to their GP and request a PSA blood test to look for potential abnormalities, provided they know and they explain to them that it isn't 100% definitive. It can lead to worry, and about 25% of men who go on to have investigations for a raised PSA, in fact more than that, will not have prostate cancer. So the real difficulty is, getting men to realise that prostate cancer is always a possibility and what to do about it.
One of the questions that has come through is, what advice would you give to somebody who is experiencing symptoms but they're a bit reluctant to go and actually get them checked out?
Well, as I said, I mean, if you get obvious urinary symptoms, then there's a good chance that it's unrelated to any cancer. But you still need to see somebody to sort of get that reassurance. Now, if you're having problems peeing, it could be because your prostate is big, it's blocking off the emptying of the bladder, which causes the bladder to go out of sync, if you like. The best way of diagnosing that is to see a GP. Again, examination of your prostate. They will do a PSA blood test, and if your urinary symptoms are causing you a problem or affecting your quality of life, then they'll usually refer you to a urologist in the hospital who will see you and do some basic investigation, which will ultimately help whatever condition you have. I know it's worrying, but as I said, the majority of early prostate cancer doesn't give you those symptoms, so it's more likely to be some non-cancerous condition, and there's really no reason why you should be afraid of going and seeing somebody and talking about it.
Absolutely. I know you mentioned that it's not only people with a kind of a known, who've had a genetic test and know that they carry a faulty gene that is at increased risk, but people who've had other members of their family who've had prostate cancer in the past. For people in that situation, is there anything they can do in terms of screening or anything like that?
Well, there was a big trial some years ago by the Royal Marsden, I believe, looking into the screening with prostate cancer. And if there is a worry that you could have prostate cancer and you are referred to hospital and a urologist, they will have that information. Because there are some trials going on looking at genetics in prostate cancer. But it's a little slightly more specialised area, and it's not something that, commonly urologists will discuss, but they will be aware of trials or things that may help identify that.
And I guess your symptoms bit there, I think everyone needs to be aware of symptoms, and particularly at the moment, even with everything going on in the world at the moment, is to go and see somebody if you have any symptoms you're worried about, isn't it?
Yeah, absolutely. I mean, as I said, if you haven't got symptoms but you are worried, then, as I said, all men over the age of 50 are entitled to go and have a chat with their GP about it. What we would suggest is, if there is a strong family history, whether it's genetic related or not, then certainly sons, maybe at the age of 45, should be having a chat with their GP anyway, and perhaps for black men, perhaps a little bit earlier. Now, the GP may say, oh, well, you're a bit too young to have this or worry about it. But, to reinforce the point that you are aware of it and you just want some reassurance about it or more information, may spur them on a bit.
And one final question, is there any way for men to reduce their risk of prostate cancer? Is there any kind of lifestyle points that are linked to it that they can do?
It's not really, it's a non-preventable cancer. As I said, age tends to be the most common thing. There have been links with diet, but as I'm sure you're aware, with ovarian cancer, this changes from, 1 month to another. There was some links, or it was felt that maybe an increased intake of processed red meat might have some effect. But again, in more recent times, it's been a little bit disputed. Obviously, a good varied diet, which is maybe low in processed foods, is always good. And research has shown that if you have got prostate cancer at an early stage and you adapt or adopt a sort of Mediterranean, very well balanced diet, then the outcome may be slightly better. But it's not, you know, nobody can really say that diet is going to help things. And what they can't tell you is when you were supposed to have been having a good diet. You know, if you've got prostate cancer and start tomorrow, will it make a difference? Well, you know, nobody knows. The only thing that has been cited as potentially helpful, which you may have heard about, are tomatoes. Tomatoes have a substance that gives them their colour called lycopene. And over the years, there have been many research trials into looking at the effect of lycopene. And a lot of trials have suggested that it may give some protection from prostate cancer, while others have been a bit more equivocal. But if, you know, tomatoes are good anyway, but it's not so much raw tomatoes, it's processed tomatoes. So, you know, a good organic ketchup or pasta sauces where things are concentrated. Yeah,
that's really interesting. Yeah, really interesting, actually, isn't it? As an idea, maybe that's linked to the Mediterranean diet, like you said. Well, I think that's really interesting. I feel like I've learned an awful lot right now from you. So thank you so much for that. What we'll do is we'll put this recording on both of our websites, and I'll make sure to include links to the Orchid site for anybody who is looking for any more information, and we can, you know, go along to your website and find out about anything that you've got going on as well, because I know you're doing a lot of awareness work as well. So thank you so much, Rob, for your time. It's really helpful, and I hope that everybody watching in the future finds this really useful as well. So thank you.
Great, pleasure.
Thank you so much, Rob. Bye-bye.
Bye.